During your reproductive days, you'll get a menstrual period about once a month. Unless you're especially squeamish, there's no need to avoid sexual activity during your period. Though period sex can be a bit messy, but it is safe. Having sex during your period can actually offer a few advantages, including relief from menstrual cramps. What are the benefits? Relief from cramps. Orgasms may relieve menstrual cramps. Menstrual cramps are a result of your uterus contracting to release its lining. When you have an orgasm, the muscles of your uterus also contract. Then they release. That release should bring some relief from period cramps. Sex also triggers the release of chemicals called endorphins, which make you feel good. Plus, engaging in sexual activity occupies your mind, which may help take it off your menstrual discomfort. Shorter periods. Having sex may make your periods shorter. Muscle contractions during an orgasm push out the uterine contents faster. That could result in shorter periods. Increased sex drive. Your libido changes throughout your menstrual cycle, thanks to hormonal fluctuations. While many women say their sex drive increases during ovulation, which is about 2 weeks before your period, others report feeling more turned on during their period. It might relieve your headache. According to trusted source, about half of women experience migraines during their menstrual cycle. Although most women with menstrual migraines avoid sex during their attacks, many people who do have sex report that it partially or completely relieves their headaches. What are the possible side effects? The biggest downside to having sex during your period is the mess. Blood can get on you, your partner, and the sheets, especially if you have a heavy flow. Aside from dirtying the bed, bleeding may make you feel self-conscious. Anxiety over making a mess can take some or all of the fun out of sex. Another worry about having sex during your period is the risk of passing on a sexually transmitted infection like HIV or hepatitis. These viruses live in blood, and they can spread through contact with infected menstrual blood. Using condoms every time you have sex can reduce your risk of spreading or catching sexually transmitted infection. If you plan to have sex during your period and you're wearing a tampon, you need to remove it beforehand. A forgotten tampon can get pushed so far up into your vagina during sex that you'll need to see a doctor to have it removed. Can you get pregnant? If you aren't actively trying to conceive, using protection is a good idea, no matter what part of your menstrual cycle you're in. Your odds of conceiving are lower during your period, but it's still possible to become pregnant at this time. You're most likely to get pregnant during ovulation, which happens about 14 days before your period starts. Yet every woman's cycle length is different, and your cycle length can change monthly. If you have a short menstrual cycle, your risk of getting pregnant during your period is higher. Also consider that sperm can stay alive in your body for up to 7 days. So, if you have a 22-day cycle and you ovulate soon after getting your period, there's a chance you'll be releasing an egg while sperm are still in your reproductive tract. Do you need to use protection? Using protection will also guard you against sexually transmitted infection. Not only can you catch sexually transmitted infection during your period, but you can also more easily transmit one to your partner because viruses like HIV live in menstrual blood. Have your partner wear a latex condom every time you have sex, to reduce your odds of getting pregnant and catching sexually transmitted infection. Tips on having sex during your period. Here are a few tips to make period sex a more comfortable and less messy experience. Be open and honest with your partner. Tell them how you feel about having sex during your period, and ask how they feel about it. If either of you is hesitant, talk about the reasons behind the discomfort. If you have a tampon in, remove it before you start fooling around. Spread a dark-colored towel on the bed to catch any blood leaks. Or, have sex in the shower or bath to avoid the mess entirely. Keep a wet washcloth or wet wipes by the bed to clean up afterward. Have your partner wear a latex condom. It will protect against pregnancy and sexually transmitted infection. If your usual sexual position is uncomfortable, try something different. For example, you may want to try lying on your side with your partner behind you.